Hey guys, we're going to do a quick in-service on how to set up the Oasis dry suction water seal chest drain. I'm going to set my phone down right here so I can show you. This is the only chest drain system that we have in the hospital. So anywhere that you work, you should only find this one. We had a different system about 1.5 years ago. It was a wet suction system, and we got rid of it because this one is a lot easier to set up and use, and it's a lot safer for patients. Of course, this is a chest drain system that you would use with all of your chest tubes. We have two main kinds of chest tubes in the hospital. One is your traditional, large bore chest tubes, which are vinyl and clear, and they're put in usually, in the OR or emergently. You probably won't see a lot of those being put in on the floor. What you see more on the floors would be your Turner pigtails, which is put in kind of like a central line. The doctor has a kit with a needle. They put the needle in until they get to the space, and they put a wire in there. Then they dilate the hole, then they put the chest tube in, and it has a little curly part at the end that keeps it in place. And then there's a connector that you plug into it, and that connects to your chest drain system. But this is the same for any chest tube. It's always going to be this piece right here. So you'll also need a suction setup. Of course, regular suction tubing, suction canister, and the regulator. And those are all the parts you need. Now, if they're putting this at the bedside, it's really easy to hook up, and you can do it pretty quickly. You don't have to actually finish setting everything up. You can literally just take it out of the box, hook it up to the patient, and it's safe to use that way. But we're going to show you the entire setup because this is how it ultimately needs to be set up when you're done with the whole procedure. So once you open this up, it's going to look like this. This is what it looks like. And it's going to have the collection chamber right here, which starts here, then it spills to the next one, then it spills to the next one, and that's how you measure how much output you're having. It has the pressure indicator right here. It has the, it's a little bubble that tells you if there's suction hooked up to it or not, and we'll show you that in a second. And it has the water, the air leak detector down here. Now, when you open it up, this is not gonna be full of water, okay? This is just one that I used before. There's a little water ampule back here. I'm gonna pop that off of there. And if you look on top, there's only one hole up here. There's only one place you can do it, and it's blue. I guess because it matches with the blue on this. So this is where you're gonna put the water in, and this is where you're gonna hook the suction up. There's nothing else to hook up down here. It's only one hole. So you're gonna grab this ampule of water, and you're gonna put the full thing in there. And what it's gonna do is it's gonna dissolve a little blue tablet that comes in here, and it's gonna float that little white float right there to that mark, and then it's ready to go. Like I said, you don't even need this for it to work at first. You can hook it up directly to the patient. This is only for the air leak detector part to work. If you happen to spill some of this water, or you don't have you lost it or whatever, just put any kind of water in here until it gets to that level. Just go slow so that you don't put too much in there. Okay, so once you've put the water in here, then you're gonna hook it up to suction. And I'll pick up the phone so I can show you. The suction should be, of course, always on continuous. Okay, not intermittent. I don't know if you can see, continuous. And you want to hooked up anything above 40. You don't have to have it right at 40. It can be 100. It can be maxed out. It just needs to be anything greater than 40. The chest drain system will be what's actually controlling the pressure. You just want the suction on the wall to be higher than what you want on the drain system. So right here, it's gonna come set at 20, and 99% of the time, that's where you're gonna leave it. You're gonna, the doctor's orders usually say to hook it up to 20. But if they wanna change it, there's a little turn thing right here that you can move that, you see it? And you can put it to whatever the doctor ordered, but most of the time it's going to be right at 20. Now, once you hook it up to suction, if you have not hooked it up to the patient, you hook it up, and you're going to see bubbling down here, okay? And that's normal. That bubbling will stop once you hook it up to the patient, okay? Now, you might have bubbles here, but that's an indicator of two things. If you have a lot of bubbles or continuous bubbles, and the patient didn't have some kind of trauma, you know, maybe it was an empyema or something, then those bubbles are probably from a leak in your connections. Make sure you check all the connections, check the insertion site of the chest tube, make sure that it's sealed really well. The other way that you can get bubbles in there is if there was some trauma, or you know, the patient has some kind of trauma to the lung, or bleb or something, you might see some bubbles every once in a while. Just, you know, if it's not from a poor connection, make sure that you let the doctor know that you have an air leak, because that could be an indication of a complication, and they need to know. But for the most part, you won't see bubbling once it's hooked up to the patient, but if you do, you might see, let me see if I can mimic it, a little bit of bubbling. And if you can see the numbers, the more it bubbles, the farther down those numbers it gets. So when you tell the doctor, hey, I got bubbling, and it's like a level 1 or a level 5, that way they know how much it's bubbling, and they can kind of tell you, oh, you probably have a leak, you need to check all your connections. Most of the time on the floors, you're just going to be exchanging these. They do put some chest tubes out on the floor, but most of the time you're just going to be exchanging these, and that's what this little piece right here is for. Now, I will tell you, this is my least favorite part of all chest tubes, is this little clamp right here. Usually once I set one up, I just take it and I throw it away. You never, ever, ever want to clamp a chest tube. There's no reason ever to clamp a chest tube. If a doctor orders for the chest tube to be clamped, then that chest tube really should be removed. The chest tube should be either to suction or to water seal, not clamped. The reason I throw this away is because sometimes we'll take the patient down to X-ray or CT, and somebody might clamp it because they might think it needs to be clamped for the procedure, and then you'll forget about it. And next thing you know, you have a tension pneumothorax. So you don't want this clip. Now, I've just saved it here before, but again, if you're changing to a new system, the new system is going to have a clip. So you can use that clip for what we're about to do. All right, so let's say that you're just changing to a new system. The only time you were ever going to clamp this is for that. You're going to clamp this right here so that you don't give your patient a pneumo. You're going to go right over here and push and pull like that, and then grab your new atrium and take the hose that came with that one and just plug the new one in. That way you didn't have to disturb the patient's dressing or tubing. You just use the same tubing, and that's that. Now, if the patient has had the chest tube for a while, I'm going to say more than 4 days, then if you're going to change the system, you should change the entire tubing, even to this. In that case, you would have to clamp the chest tube itself and then put this in. But you really want to do this thoroughly. You want to, make sure your hands are clean, and you clean the dressing and clean it with chlorhexidine so that you don't contaminate that system. The other pieces of this, it's got this little lever right here that allows you to stand it up. And then up here, it's got the 2 little hooks that you can hook it from the bed for transport. And again, this is a dry suction system, so if you happen to flip it on its side, it's fine, just flip it back up. And you might lose track of where your fluids were, but it's still going to be just as functional. The old system, you had to throw it away. You couldn't use the same one. Anyway, I think that about covers it. If you have any questions, make sure that you post them on your Facebook page, or let me know, or your director know, and we'll answer all the questions that you have. Okay, hope it helps.